Stanford University.
So tonight I'm going to talk about skincare and some basic skincare, and then really focus on cosmeceuticals and some of the controversies and the advantages and disadvantages of cosmeceuticals. And then I'm happy at the end to answer as many questions as you want. I passed out samples of Aquaphor. It's a pretty straightforward moisturizer, but it's also very important. So just before we get into cosmeceuticals, in terms of soap and water, we've been trained as a society, and maybe it goes back to our Puritan ways of really washing our hands, or maybe it's just being obsessive compulsive. But soaps actually dry out your skin, and you need to be careful. So in dermatology, I mostly do cosmetic dermatology and skin cancer and facial reconstruction up in the North Campus, but I also see patients for skin checks. And the number one problem that I see, aside from maybe too much sun exposure, is really dry skin. And dry skin is the bane of everyone's existence, because if your skin is dry, then there's a cascade of events that happens that's not necessarily good. So you don't want to dry out your skin, and soaps naturally do that. They do make you smell better. They do clean you, but I think too much has been made of that. You don't need to use soap all the time. Certainly not many times a day. I mean, washing your hands is fine before you eat, but taking many showers with soap will dry out your skin. And then when you do use soap, you want to use with high moisturization. One of these would be Dove. And I have to say, before we keep going, because I'm going to mention a number of products, I have no conflicts of interest in terms of stocks or anything. But I tend to like Dove, and it's a personal preference, and I think some of this is just trial and error. For instance, Irish Spring, even though it does smell good and it has great commercials, it's going to be drying and harsh to your skin. So men like to use it, but it really can dry out your skin. So water also dries out your skin too, and it can cause maceration. And there's a temptation to take a lot of showers or to stay in the bath for a long time, but it will definitely dry out your skin and wick moisture away from your skin. And the number one problem that we see in relation to water is obviously hand dermatitis, or basically chronic maceration, or your hands being wet all the time because you're washing the dishes, or you're washing your hands. And what happens is it removes the lipid base. You have a very strong protective layer. The body, as you know, is amazing, and the skin is pretty amazing itself. It's the largest organ in the body, and it is the organ that is most exposed to the environment. So through evolution, it has a number of protective aspects to it that will save it from cold and hot and everything else. But if you abuse it, then these lipids, for instance, that help protect your skin, or this fatty layer, and this what's called the stratum corneum, which is actually dead skin, will go away, and then you'll be prone to hand dermatitis. And really, what hand dermatitis is inflammation of your hands. So dermatitis is one of these diagnoses that dermatologists like to use for many things, and really it just means inflammation of the skin. And there are a number of ways to treat it, but really the most important aspect is really prevention. So if you do have to wash dishes, or if you're washing the floors, you need to wear gloves all the time, or the bathroom, anything that may expose your hands to moisture. It's very important. And really, you need to moisturize your hands 2 to 3 times per day. Because what happens, and we see this when it's too late, is that we'll see someone in their 5th decade, and their hands will have all these cracks, and it really does hurt for those of you who know, and especially during the winter when there's less humidity, you'll notice that your hands are much drier, and you'll get cracks. And by that time, it's almost too late. You can moisturize your hands by using different moisturizers, but mainly when you go to a dermatologist, we'll probably give you topical steroids. But what happens when your hands or even your legs get dry on men, we see particularly on the shins that they get flaking and dryness of the skin, is what happens then is some of your pain fibers start going off and you get itchiness. So pruritus is the technical name, but itching is the common name, and itching basically is pain. It's a symptom of pain, so you start itching. And then what happens when you start itching? Well, you start scratching. Well, the problem with that is twofold. One, when you start scratching, your skin, which is amazing, reacts to that by thickening itself because you're traumatizing it, so it wants to thicken itself. But when it thickens itself, it starts itching more. And then you're in this vicious cycle. And then also what happens is that underneath our fingernails, many of us have staph or bacteria. So you start scratching, you have cracks in your skin, and then you have this bacteria, Staphylococcus aureus, which is also known as golden staph or other things. And then you can impregnate your skin, so to speak, with the staph, and you'll get an infection. And that only makes things worse. And so it's downhill from there. And then so what we'll do is we'll say, well, you need to use moisturizers, and we'll give you strong, potent topical steroids, which does work, but it's only temporary. So really moisturizing your skin and preventing all of this is really the key. So in terms of photoaging and how to slow it down, this is a good example of someone who obviously didn't use moisturizer and what can happen with the harsh environment. This is a woman, famous photo from National Geographic of when she was 15. And then this is right before 1979 was the first photo. And the second photo was after the Soviets left Afghanistan, and she was about 30 years old, or in her early 30s. So you can see what happens with a harsh environment to the skin, particularly on the face. So the issue with cosmeceuticals is really what to believe and what not to. There isn't that much science behind it, but they do work, and obviously it's a multi-billion-dollar industry. And you're barraged with advertising by dermatologists and non-dermatologists and everyone else. So cosmeceuticals was actually a term that was coined by Albert Kligman. He's a dermatologist who unfortunately passed away at age 93 this past February. He's very famous in our field because he made Retin-A. So Retin-A, which I'll talk about in a little bit, is very good for acne and one of the foundations of skincare. He also was infamous because he worked on he did research on prison inmates at the Holmesburg prison in Pennsylvania, which drew a lot of federal investigations. But he was pretty amazing in what he did. And he actually coined the word or term cosmeceuticals, and basically it's a cosmetic that has biologically active ingredients, but it's not a drug. And so but it's more than a cosmetic that you put on your face to camouflage. So the problem here is in the United States, it's not FDA regulated. And in fact, if you look through the FDA, some of their literature, they don't even recognize or talk about cosmeceuticals at all. So that's a problem because, again, what do you believe? Even though the FDA, some of the rules are meant to protect us, even though drugs take many, many years to come to fruition, with cosmeceuticals, they can just go right on the market, essentially. So the first cosmeceutical is actually a moisturizer, and Aquaphor, which we handed out, is an important moisturizer. And again, the reason that these are important is that, and again, it's not a drug, but it does create a barrier to the harsh environment. And what it really does is it decreases water loss, because when you have water loss, or we call it transepidermal water loss, then your skin starts to dry out, and then all these harmful things happen. And it's interesting, your immune system within the skin doesn't work as well. So water is really key, and the moisturizers will create a barrier. The most effective moisturizer is petrolatum, and everyone knows about that. It reduces water loss actually by 99% if you were to slather it on your skin, over all of your skin, which wouldn't be that easy. But it helps with barrier repair. Not only does it create a barrier, but it also helps with wound healing. Because we found the way wounds heal is keratinocytes, or these skin cells, when you have a cut, they jump over each other. It's called diapedesis. And there's all these growth factors that also act, but this occlusion helps this ladder or lattice work to form when you have a cut. So petrolatum can help that way. And there have been numerous studies with Vaseline, for instance, which petrolatum makes up Vaseline, that really does help with wound care. It's hypoallergenic, petrolatum, which is good. And it also decreases fine lines caused by dehydration. This is a common theme that I'll get back to with cosmeceuticals, is that they say that whether it's Strivectin or, not to single out a cosmeceutical, but that it decreases wrinkles, and that all these models use it, or Jane Seymour uses Next Advantage. And of course she has gorgeous skin, but she's also probably using many other things too, and probably Retin-A. But what happens with cosmeceuticals or anything in terms of decreasing wrinkles is really it's decreasing hydration, and it's hydrating your skin, so it's plumping up your skin. So if you have fine wrinkles and it's plumped up your skin, of course you're going to have less wrinkles. It just doesn't last that long. And then also petrolatum, because it's covering, if you have little nicks in your skin, you have nerve endings that are very superficial. If you can cover those nerve endings, just like with a Band-Aid, but petrolatum is better, then you won't itch as much because you don't have these raw nerve endings. The problem with petrolatum is that it's greasy. So therefore, a lot of manufacturers will add dimethicone, which is it's basically from silicone, and you've seen this kind of makes things slippery, and it's found in sand and quartz and granite. So that's added, and it acts as an emollient. So that's an important term in dermatology or skincare, because emollients will smooth the skin. And what they do is you have all these dead keratinocytes on the surface of your skin making up what's called the stratum corneum, but there are gaps within these dead keratinocytes, and the emollient fills in those gaps. So it'll make your skin appear smoother. So it's a good thing if you have to go to a social event to use an emollient. And it also helps with water resistance too, which is good because, again, it will decrease that transepidermal water loss. The third important component for moisturizers is glycerin. And glycerin is what's called a humectant. And humectants draw water from the deeper parts of the skin. The skin is made up of the stratum corneum, which is the dead layer, and then underneath that is the epidermis, and then you have what's called the dermis, and then the fat. And then underneath that is what we call fascia, which lies above the muscle, and then you have tendons too, and then bone. And so it draws up water, and what it does by doing that is it creates a stronger barrier by drawing up water up into the top layer. And then it's interesting that glycerin has a reservoir quality, that glycerin's effects, even after it wears off, will last a long time. So you can put glycerin on your skin, it'll wear off, but it'll have that safety effect of creating a water barrier on your skin, which is good. So in terms of moisturizers, they're over-the-counter. Generally, you don't need to have prescriptions. The common ones include Aquaphor, Cetaphil, Eucerin. And really, I believe, when patients come to me, they always ask, obviously, which one do I prefer? But I really think that it's patient-dependent or it's individual-dependent. If you have very dry skin, you may want Aquaphor. I use Aquaphor a lot after laser therapy because it's very moist and greasy. But on an every daily basis, you may not want that because it's greasy. Whereas Eucerin is creamier, and it's not as effective as Aquaphor, but it's just more cosmetically appealing. So I really think it's trial and error. The most important aspect about moisturizers is that it's important to reapply them multiple times per day. I think for men it's very difficult to do this because it's a hassle, and their wives or significant others need to reinforce this, but it's really important because it wears out. So reapplying multiple times a day, up to 4 times a day, is really important. The next most important cosmeceutical are sunscreens and sunblocks. And as you know, these are agents designed to either absorb or reflect UV rays. Ultraviolet rays from the sun are categorized as UVA, UVB, and UVC. UVC are not absorbed. They don't come down to Earth. So it's really UVA and UVB that we're concerned about. UVB tends to cause sunburns, and it doesn't go as deep, whereas UVA will cause skin cancer, and it goes deeper, and it can cause all types of mutations in cells. And there are 2 different types of sunscreens. One is organic, and basically that absorbs sun rays and turns it into heat. And that's the most popular type, although I like the inorganic filters because they reflect sun rays, and those more commonly are known as sunblocks. The SPF has a lot of mystery around it. It's known as sun protection factor, and it ranges from 1 to 90. And basically, this SPF number is determined experimentally, and so what they've done is they bring people into a room just like this and expose you to this very bright light that simulates the noontime sun, and then some people wear sunscreen, and then you have a control group that doesn't, and then they figure it out mathematically based on how much less the people will burn. Of the ones who are wearing the sunscreen, if they burn less, then they assign a number to it. Practically speaking, and there's a lot of publicity around, well, you should wear a higher number, and that's true to an extent. A lot of moisturizers have 15, and in my opinion, that's not enough. You need to have at least 30, because 15 wears off too quickly, and also it gives you a sense of false security. So you want to really wear between 30 to 60. Once it gets beyond 60, I think it's more of a marketing concept. So my choices, and again, a lot of this is trial and error. If you go over the counter, I think Neutrogena has many good products. They tend to be less greasy. We usually recommend something called Helioplex. You probably know of that, and it's relatively inexpensive. In terms of sunblocks, that's really what I like because it's not absorbed. They're made of microparticles, and this is what the in the beach they used to wear and with their white noses, but it's gotten much better with the zinc oxide and the titanium dioxide. Titanium dioxide protects from 250 to 340, whereas zinc oxide actually protects from that wavelength, which is UVA and UVB, but it also goes higher in the UVA range, which is good. So actually zinc oxide is more comprehensive. And they come in these, they're micronized now, so they're much more cosmetically appealing. Tysilk sheer is very popular from a cosmetic standpoint. SkinCeuticals, we sell that, but it tends to be creamier and it has more substance to it, but someone with very oily skin may not like that. There's one called Tyzo 3 SPF 40, which is very good. People like that because it's very sheer, so it's not thick on your skin or heavy on your skin. I used to consult and do skin cancer checks for the women's tennis tour, and the teenagers they hated wearing sunblock because, and it was hard. They're all prone to skin cancer because they're on the sun all day, but it's dripping down in their face, and so you have to get one that's pretty sheer. And also with Tyzo, it's a good concealer too, so it acts as a concealer. We also have Color Science. It's actually a local company, and a lot of people like this because it's a brush-on powder. So a lot of people just think the SkinCeuticals or whatever is just too greasy and you have to put it on there. Well, you can use a brush, just like a foundation, and put it on there. It's usually doctors' offices sell that, and it comes in different colors depending on your skin type, and it's a pretty good concealer. So I like that. Other ones, Blue Lizard is Australian, and it's thicker, but it has excellent protection. There's a L'Oreal called Shake a Shake, has Mexeril. Mexeril's pretty new, and it's not very. You can't really get it in the United States. Except for L'Oreal, because it's in other countries. It's been very popular. It absorbs sun rays before they penetrate the skin, and it may become more accessible. That's the word I was looking for, accessible in the United States in the future. But in Canada, they use it more. Right now, even though there's been talk about some homeopathic oral sunscreens where you can take a pill, there's no good science behind that. Really, the best sunblock is sun protective clothing. Cool Bar is an Australian company. And you really want to use hats with big brims. Baseball caps are good, and I see someone with that. The only problem with that is that it doesn't protect your ears. And I do all this skin cancer surgery here at Stanford, and men, they always come in. And today I did 10 we had 10 patients with surgery today, and 2 or 3 had cancers on the top of their ears. So it's important to get used to wearing hats with brims, particularly during the noontime. Cool Bar and there are other companies too. They have lightweight clothes. It doesn't seem like you'd want to wear them, but they are lightweight, and they have titanium dioxide microfibers in there. So they really protect. And really, when you want to go out in the sun, I mean, this is California, so you do want to go out, you want to try to avoid direct sunlight from 11 a.m. to 3 p.m. I wanted to talk a little bit about the vitamin D controversy, only because there is controversy within the dermatology community. There's a dermatologist named Michael Holick who has come out against sunscreens and sunblocks, and that it's a hoax in a way because it's creating vitamin D problems. And obviously vitamin D is extremely important. As you know, you do get it from sun. You can get it from your diet too, from oily fishes or fortified milk. You can also take it as a supplement. And it works as a hormone, and it regulates your parathyroid hormone and basically your balance between calcium and phosphorus in your body. And it's really protective, as you know, for bone fractures, against rickets, osteomalacia, and particularly osteoporosis. And also it's been shown it may decrease chronic illnesses, in particular some cancers, maybe even cardiovascular or heart diseases, and immune disorders. And there's one study that it even had a decreased incidence in the winter flu. So vitamin D is really good, but the question is if you're using sunblock or sunscreen, is that hurting you? So, I mean, there really is decreasing levels of vitamin D in the population, particularly in the older population. We think that maybe twice per week exposure to midday sun for about 5 to 30 minutes may be needed. And so really, does photoprotection, is that going to hurt you? Well, it's really an open-ended question because there are many environmental factors that can decrease sun exposure. It's not just sunblock and sunscreen. Increased latitude, I mean, if you're up north, it's going to decrease vitamin D. The season away from the solar noon is going to decrease the sun or vitamin D synthesis. Lower altitude, increased pollution, thicker cloud cover, and obviously when we get a little bit older, our metabolism isn't the same in terms of vitamin D, and also if you have increased skin pigmentation, you're not going to get as much vitamin D synthesis. But there have been a number of studies looking at whether different SPFs do decrease vitamin D. And basically in Australia, they showed really it doesn't. They had a placebo group and those that had sunscreen, and really there was not a decrease in vitamin D. And there have been other studies too that basically in rats there may be a decrease in vitamin D or in the lab, but clinically it's not really relevant. So the take-home point with that is that you should wear sun protection because skin cancer is not a good thing to have. It creates downtime. Melanoma is deadly. And vitamin D is important, but especially in California, you can get enough vitamin D even with wearing sunscreen and sunblock. So the advantages of wearing photo protection outweigh the disadvantages. Not to say, but again, vitamin D is important. So I'm coming down on the side that sun protection is important, but you have to use common sense too. So if you need a tan too, I mean the other controversy with sunscreens or tanning is tanning beds. And fortunately they've passed some laws now taxing it in the new health care reform and also making it illegal for teenagers, or I guess under maybe the age of 15 in California, to use tanning beds. And tanning beds cause skin cancer and mutations in your skin. So if you need a tan, it's better to use what's called DHA, and you can go commercially to these places that it's like a car wash and they'll spray you. And that's fine. It's not something I would do. I mean, strip down. I've had a lot of patients who do it, and it works, and it's fine. And it works right away. And if you have a wedding or an event to go to and you feel you need to be tan, this is a good way of doing it. You can also have sprays, and you can spray it on. It's just that when you go to these commercial places, they do it in a more even fashion. And it works right away, and it can last up to 7 days. And it doesn't harm you. So it does work. There are other types of cosmeceuticals. A popular one are antioxidants. And basically, they're free radical scavengers, and they're composed of the different types of vitamins, vitamin C, vitamin E, zinc, and then also these dietary flavonoids. And these are controversial. I'm going to talk about them in a little bit. But, I mean, it does seem healthy, obviously, to eat blueberries, but the question is exactly what are they doing to your skin? It's not entirely clear, but green tea is popular. Does it work? I'll tell you in a second. Red wine is obviously good for your heart, but does it work for your skin? It's not entirely clear. There's also alpha-hydroxy acids. These are also considered cosmeceuticals. And an example is glycolic acid or triple fruit acids. And what they do They remove dead or irregular stratum corneum cells, so they make your barrier more even. However, these can be sun sensitizing and also irritating for some people. And the higher the concentration of the alpha hydroxy acids, the higher the acidity and the more that it burns. So, but they are used particularly in dermatology offices, and they do work. If you can't tolerate hydroxy acids, you can go to salicylic acid, and that's weaker, but it also has another benefit, that it enters the sebaceous unit. So if you're having problems with oily facial regions or comedones, zits basically, it may help remove those comedones because it actually goes into where the pimple is forming. Vitamin A is the most important cosmeceutical there is, aside from moisturizers and sunblock. And it has the best science, and that's what Albert Kligman helped. He discovered that, and it's a really important. And it's found in different types of foods. The question is if you eat enough carrots, will it make a difference, or will you just turn yellow? It's not entirely clear, but retinoids are the family from vitamin E. And I did a study, for instance, about 10 years ago showing with a bunch of other people in veterans that if they had skin cancers on their face and then we applied Retin A to their faces every day, they statistically would have a decreased chance of having skin cancers. And Retin A also does help with wrinkles, or at least with fine lines. So it really does help, and if you use it and start using it every day, the issue is you have to use it for the rest of your life, is that it will, if you take a photo now and a photo in 6 months, you will notice a difference in the quality of your skin. The issue is it can be sun sensitizing, so it increases you to the possibility of sunburns, and also it can irritate your skin. So a lot of people have problems with it, so we can decrease the percentage of it, or you can use it every other day. I used to poo-poo retinol. So retinol is the over-the-counter version of Retin A. But the issue there is just not as strong. So does it work? But the problem is a lot of people just won't tolerate Retin A, and then they won't use it. So if you're not going to use it, then it's better to use an over-the-counter version that's weaker, because at least it'll do something. So at this point, I do recommend retinol if you can't tolerate Retin A. And Retin A, if you're over 30, generally speaking, your insurance may not cover it, and it can be expensive. So if you have teenagers, it does cover it for pimples. So get it from your teenager, or get it for them, and use it. Don't tell anyone I said that. But vitamin C is very important too. So what they do, all these vitamins, they scavenge free radicals. So these free radicals break off of molecules in your skin, and what they can do is they can break up your DNA or mutate your DNA and cause toxic reactions. And then what happens is when your DNA breaks off and becomes abnormal, this is at the beginnings of cancer. And it can happen in the skin, it can happen other places too, and there are all these what we call promoters, and it becomes a cascade, and then you get these totally abnormal cells, and they become cancer. They disrespect their neighboring cells and start growing, and they're non-functional. So vitamin C plays a role, at least in the skin, of quenching these free radicals, which is good, and may also play a role in wound healing. Vitamin E is also very common. It's found in oils, seeds, whole wheat. I'm not that big of a fan. I mean, it's gotten a lot of marketing over the last 25, 30 years. It does help, but the problem that I've seen is that it increases skin sensitivity, which is not good. So a lot of people get a lot of redness and then not use it. Niacinamide is from nicotinamide, another vitamin. It functions as an excellent exfoliant. And also there's some evidence in Europe that it may act as a suppressant for skin cancer. And it has these anti-tumor characteristics, but I think the jury is still out with that. There are also copper peptides. We did a study on wound healing a number of years ago and gave a number of presentations showing that copper peptides, at least after certain skin surgeries, will help with better scarring and wound healing. Although we also showed that moisturization in general, if you moisturize your skin, which we do after I do surgery, that it will also help with better scars. But copper helps with wound healing. There's been a lot of marketing and hype about topical botanicals or from plants. So soy is one of the most common ones, and it's a flavonoid. And basically, it acts as a phytoestrogen. So estrogens, as you know, are good for your skin. The question is exactly how good it is, because when you take it orally, obviously, estrogen can decrease heart disease and breast cancer. There have been a number of studies. But the question is, topically, what does it do? We do think that it may increase the thickness of collagen, and collagen is in the middle layer of your skin. And when the collagen gets destroyed along with what's called elastin, that's how you get wrinkles. So it may actually help with that, and it may act to get rid of free radicals. There's also something called silmarin, and that's from the milk thistle plant. And this includes daisies and artichokes and also thistles. It's another flavonoid, and it can be put on your skin in mice. Again, it has this anti-cancer effect. The question is, in humans, what exactly does it do? But, I mean, if you go online, you'll see this all over the place. Curcumin actually may have a little better science behind it. It's a polyphenol, which is a type of antioxidant. It's from the turmeric root. It's this, as you know, a yellow food coloring, and it's almost ubiquitous in our foods and snacks and meats. And it actually has an excellent antioxidant effect. But again, the question is what will it do long term? All these different topical botanicals are begging for research studies. Green tea is the most common one. I think because there's an Eastern mysticism to it, that we like to think that it works. It acts as an antioxidant. It's also anti-inflammatory for the skin, and also it's anti-cancer. But again, what's the actual evidence for this? Not entirely sure, but I'll show you one study in a moment. Then there's nutraceuticals. It comes in drinks and gummy bears. You know, the question is, do they work? I was asked by Newsweek. I said no, but I'm sure it tastes very good. Because again, it doesn't quite make sense, because you take it and it goes into your stomach and it does get absorbed by your body, but it's metabolized by your liver or kidneys, and it doesn't necessarily get to your skin. So even though it's an antioxidant, it has to get to your skin in order to help it. So in many ways, topicals may work better, but there's really no evidence yet that these work. And actually, a colleague of mine, Ann Chang, in our department, did a 2-year randomized double-blind study with green tea. And it was oral green tea. And this has been published at this point, and as you know, it's been imbibed for centuries, and it has all these properties, and in theory it should work, because it seems like people who drink green tea live a long time. But they did the study, and basically, at least with photoaging and spider veins and redness, it really didn't do much. I mean, these are pictures of before and afters. I guess I don't have a pointer. Oops, sorry. But, oh, there we go. Sorry. You know, I mean, there is a difference that Dr. Chang is showing, but it wasn't significant in terms of statistics. So basically what they felt is that there's no detectable improvements over the placebo clinically, or they took biopsies, and there's no evidence from a histologic standpoint that there was change, which is disappointing, because we'd like to think that green tea actually works. Another cosmeceutical that is a cornerstone of reducing skin aging are bleaching agents. And hydroquinone is basically the foundation for this, and you use it for sunspots and pigmentation from trauma, something called post-inflammatory hyperpigmentation. And basically what it does is it inhibits an enzyme known as tyrosinase. And that tyrosinase within your melanocytes are your pigment cells, and they're at the base of your epidermis, which is the top layer of your live skin. And basically it stops the reaction of creating pigment. And so you can use this, and it actually does work. Over the counter is only 2%. If you want more, generally you have to get a prescription for it, and it can go all the way up to 8%. It does take several months to lighten a dark spot. It doesn't work right away, so you have to have some patience with this. The problem with this is that it's been shown to cause something called ochronosis, meaning that it can cause deposition of these dark granules in your skin, and it's supposed to be doing just the opposite. And also, if you have darker skin and you're using 8% or higher percentages, it can cause this paradoxical darkening, which is maddening for the patient and for the doctor, obviously. And then now, in rats, they showed there's some controversy because it can cause cancer in rats, because hydroquinone is a benzene derivative, which has been known to have problems. But It's never been shown to show cancer in humans, and basically our academy supports the use of hydroquinone, and I do too because the science just isn't there, and it does work. Right now it can be combined with retin-A and a steroid, and that's known as Triluma. And that is not over-the-counter. You need a prescription for it. And it really is the most effective formulation for treating dark spots. However, the issue with this is that it has a strong steroid, and you can only use it for 2 to 3 months at a time. Regular hydroquinone you can use for a long time. But this is also less irritating because it has a steroid, although it does have retin-A. And again, retin-A is key, but it can irritate your skin. So I'll put people on it for 2 to 3 months, and then they'll take a holiday for a couple months and then go back onto it. But right now, it's the best. You can also combine hydroquinone with glycolic acid. That's known as luster cream. I did a study that I published about 9 years ago examining this luster cream for pigmentation on your chest and neck. And we had 19 women, and they applied it twice per day for 12 weeks. And basically, there was a 33% to 71% improvement in sun damage, fine lines on the neck and chest, pigmentation, texture, dryness, and also just the tone of their skin. And here's just one picture. And let's see. Oh, there we go. So you can see it appears lighter. I mean, part of it is that the flash was a little bit brighter, and this is the after photo. But there is less pigmentation, particularly on the upper chest. So it does work, but it takes a while to use. There's a new bleaching agent on the block that actually was described and developed at Stanford or by a Stanford dermatologist. Again, I have no stock in this, although I'm going to just let you know we're going to probably do a study, and you can look on my website. It'll be free, where we're going to try to do some blinded studies on whether this really does work. It's called Lumoxil, and the good thing about it, it has no cytotoxicity, because again, with hydroquinone, it has cytotoxicity, and it can lead, in rats, to mutagenesis and potential cancer. So this works in a much different way. It's a peptide. And basically, in a pilot study, the company at least showed that over a 16-week period, it significantly lightened pigmentation, and is well tolerated. It's not irritating like hydroquinone, and you can use it for long term. So really, with cosmeceuticals, there are limitations. I really do think they should be a necessary part of your skincare regimen, but you have to look at what's hype and what's the true effect. There aren't that many good studies, and really it may be because of the moisturization and hydration, and that's really why it may work. So what I use, my baseline cosmetic regimen for my patients, I always want them to use sunblock in the morning. It can have titanium dioxide or something called Parsol 1789, also known as avobenzone, and you have to look on the back for those. It's not going to tell you, and a lot of these sunscreens will say sunblock, and they're not really a sunblock. You can use luster cream every morning or Lumoxil, and then an antioxidant every morning. I like using Renova at night. You use it at night rather than in the daytime because it is sun sensitizing. 0.05% I think is reasonable. And then a hypoallergenic moisturizer at least twice a day. This is going to run about $100 a month, but in the end, it'll be worth it if you are concerned about your skin. I wanted to talk, the last part of my talk, I wanted to talk about a topical nutritional pyramid system. A Hawaiian dermatologist who's a colleague of mine, a friend of mine, she developed, and I've modified this into thinking, trying to create more of a systemic basis for skincare. Because I think people will use it more if there's a system or if there's some rationale. So basically, skin should be looked at just like food in a way, or skin should be looked at as something like the nutrition pyramid, and that you have a diet for your skin. And so basically, there are 8 basic groupings of skin rejuvenation products, and at the base of this, and I'll show you this little pyramid, are products with the most scientific data and known value to the skin, and then we have a companion guide that we give out to our patients. And then we have a matrix where we can customize treatments in terms of skincare for different types of skin conditions, because again, it's either trial or error, because one cosmeceutical is not for everyone. And then what we've done is we've made 21 categories for different skin types. And so here it is. So there's this pyramid. And so sun protection is number 1. And then retinoids is number 2. Vitamin antioxidants is important. But going up to the narrowest point is where there's less evidence. Growth factors are important. But again, and peptides we know are important, and particularly tissue components. So tissue components are the new hot cosmeceutical, and basically they have things like collagen or hyaluronic acid or elastin, because what happens, we think, particularly with elastin, it's what holds your skin, it makes your skin elastic, and the sun really damages it. And you can really see it under the microscope when we take a skin sample. So if you add elastin, is it going to make your skin more elastic? But the issue with all of these two, I have to tell you, is the absorption, is that growth factors are great. Peptides are great, but how does it absorb into the skin? It has to get through the stratum corneum, and again, your skin is an amazing barrier, so that's an issue. But this is kind of the skin nutrition pyramid. And then what we do is so if someone has peri or postmenopausal skin and sunspots or freckles, then what we recommend, and we have this whole list, is a gentle cleanser in the morning, and then retinol, a face lotion, a sunscreen, and then also during the midday, another type of sunscreen. And then the evenings, you use another gentle skin cleanser, copper, and then an emollient, and then a vitamin C firming mask. So we come up with this, with this guide, and we're doing some studies on it. And I don't know, we feel that using a system may, in the end, just create better results for your skin rather than doing it haphazardly. And then also with this, you're going to add something called intense pulse light every 3 to 5 weeks, or a silk peel package. Or if you have blood vessels, for instance, I'm not going to go through all 21, just these 2, and acne-prone skin, in the mornings you want to use a simple clean cleanser. You want to use a lotion with retinol, because retinol or retinoids will clean out your comedones or your pores. You want to use a sunscreen, and then also midday, again, you want to use a color science powder. That's important. Again, it's a sunblock. And then in the evenings, again, using a cleanser, and then this retinoid, and then this clay mask, which will help with your acne, or a vitamin C firming mask. And so we have this entire protocol, and I think it just works better than using 1 or 2. In the end, how effective are cosmeceuticals? That's a very fair question. In some ways, how effective are cosmetic procedures? That's a very fair question, too. For wrinkles, a colleague of mine at Stanford did a study with 2 over-the-counter wrinkle medications called Freeze 24/7 Anti-Wrinkle Cream and then Lift Fusion Transdermal Face Lift. And they did it versus a placebo, and they had 42 patients. And they compared it. They had the patients put it on, and they compared both sides at 15 minutes, 30 minutes, and then 7 days. So there was self-evaluation by the patients and then also independent doctors. And the conclusion really was there's no difference. So again, I mean, when they have the models, whether it's Jane Seymour or whoever, it's because they genetically may have great skin, and they're probably using other things they're just not telling you, or it takes more than just a cream to really make your skin look great. So how do you increase the absorption of a cosmeceutical? Because I really think that that's the important aspect. And so I like this photo because it's actually a computer-generated photo of a 25-year-old woman then 50 years later. And you can see what happens with aging naturally and with sun damage. So how do we get to the right side, or that left side of the screen? So the issue is how to increase absorption, and that's the bugaboo here. And we don't have a good way yet, but you can you can abrade the skin. And that's what a lot of dermatologists are doing. So you're breaking down the stratum corneum and also making the epidermis susceptible to whatever you're going to add to it. And so there's something called a silk peel, which we use at Stanford, and it's kind of a combination of turbocharged microdermabrasion, and so we rub off the skin, and then we infuse different types of chemicals, whether they're acid peels, hyaluronic acid, vitamin C, salicylic acid, or kojic acid, which can act as a bleaching agent. And that way, it actually works much better. And then a silk peel, so here's just before and after. We also use it for acne. And you can see that this is after 6 treatments, just not 1 treatment. But there's no downtime with the silk peel, but it also will help get these medications to absorb, because again, sometimes if you're just putting it on your skin, particularly some skin types, it just will not absorb and you'll be wasting your money. There's also combining these antioxidants with intense pulse light. Intense pulse light is like a laser, but what it does is it makes your skin and blood vessels more susceptible to entry from these glycolic acids or cosmeceuticals. And so this is before and after of a few treatments with the intense pulse light combined with a bleaching agent. So you can tell there's a difference, and I can tell you that if we just used intense pulse light, you would not have had as much of a difference. So you want to combine things. There's no magic bullet for your skin. Here's another example. And so basically it's lightening on darker skinned individuals using Triluma and then using intense pulse light. So there's lightening of freckles and skin. And this is for blood vessels. Before and after, again, if you just used IPL or intense pulse light without an antioxidant, you wouldn't have the same effect. You can also do something called fractional resurfacing. You can do that alone, but we found that if you use antioxidants with it, you'll get much better results. So you can get a result like this, which is definitely different. And again, if you just use fractional resurfacing, you will get good results, but it's better when you combine things, and that's really the take-home message here. Here's another, this is using Triluma. And so afterwards, it's not perfect, but there is a decrease in the pigmentation. And for acne scarring, I've used retinoids, so they can help smooth your skin, but it's hard again, particularly on male skin, which tends to be thicker, and pitted like this after acne scarring, it's not going to enter the skin. So if you fractionate with a laser, and basically it's creating holes in your skin, these microscopic holes, which is fine, and then you infiltrate the retinol, you're going to get a difference, and it's going to be better than just resurfacing alone. And then in the end, in my opinion, cosmetic surgery is really, if you want to have differences, cosmeceuticals only go part of the way. And really, still in my opinion, doing cosmetic surgery, say a mini lift and a blepharoplasty, there's no way that cosmeceuticals will ever reduplicate something like this. So in the end, procedures are still better, but skin, taking care of your skin, if you're not going to do surgery, is key. And so really, skin aging does happen, but what you need to do is sun protect, use some type of retin-A, whether it's over-the-counter retinol or a prescription, use an antioxidant. If you're going to treat it, if you already have the sun damage, you need to use gradual procedures by combining creams and then either light, like a laser, or mechanical features, such as silk peel. And then what I really think what we're experimenting with more with skin cancer, though, is using molecular probes that are activated by light. And I think that's the real focus and where it should be. Stem cells may also help, I think, with skin. But these molecular probes will help target skin cells, and then that will really work in the future. And then there's some experimentation or projects at Stanford where you can put what are called molecular tails onto cosmeceuticals, and it will penetrate down through the stratum corneum and also get absorbed by target cells. So what you don't want to do is let your skin dry out. You don't want to expose your skin to harsh chemicals, and really you don't want to believe all the hype. Thank you very much. Sure. So retin-A will only work when you're using it. So you have to use it. I mean, it will help while you're using it, but if you stop, your sun damage can come back if you don't protect yourself, or if you had the wrinkles, the fine lines may come back. So it's something that you use for the rest of your life, because what it does is, it's been shown, and the science is good behind this, is that it actually regenerates your skin. So it will get your skin to create new cells, and it will also help with collagenesis, which is the middle layer of your skin, and it will decrease wrinkles that way. But if you stop it, then your skin will continue to age. So the key with retin-A, though, is that it can be harsh, and people don't like it because it'll dry out your skin, and you won't use it. So that's why we kind of recommend using a lighter version of it, which could be 0.02%. I like Renova because it's cosmetically nice, but other people like different types of retin-As. You can start using it every other night, so you can tolerate it, and then you put a moisturizer over it. But that's why you need to use it. It's just like using minoxidil or Propecia for hair loss. You have to use it forever. Or Latisse, if you want to grow your eyelashes, you have to use it forever, else it won't grow. Yes?
Curac and Effudex.
Yes. Well, I stayed away from skin cancer. I stay away from skin. So the question is Curac, and Effudex, and what about those? And actually, it's a good question. I should have probably included in my talk. It's more for skin cancer, although I have to say, so what they are is Effudex is 5-FU, 5-fluorouracil, and it's used for cancer. And some of you may be familiar with it, is for chemotherapy. And they found a long time ago that when they're using 5-FU for chemotherapy for various internal cancers, people's skin cleared up, or their skin cancers went away. And Curac is a non-steroidal, and that's also been shown more and more to help with skin cancers. So I use it mainly for those with precancers, for actinic keratoses, are called precancers. And so when you go to a dermatologist and you have these precancers, they can also freeze it. They can use liquid nitrogen, but that can cause all this redness, and it's hard to do it and blanket it because people will look like entirely red, which they don't like. So you can use Effudex. And you can. I like using it particularly in men on their foreheads or those who have receding hairlines. And you can put it on your scalp, for instance. You have to use it for 3 weeks, twice a day. The issue with that is that it really lights up the precancers, and it can cause a lot of irritation, and people don't like it. So I use Fluoraplex. No, that's 1%. Effudex is 5%, so it's weaker, but it also works better. So if you're interested in that, I would ask your dermatologist for Fluoraplex, 1%. Curac is also good. And also, you see that your skin will improve. But I wouldn't just use it to improve your skin. It's really for precancers. But again, compliance is an issue with that. Yes?
Is tretinoin a retin-A?
Yes, tretinoin. So it's tretinoin retin-A, or a retinoid. And it is. It's the generic name, and perhaps I should have used that. Since it's not really supposed to use trade names. So tretinoin, there's different versions of it. So you can use retin-A micro, and a lot of teenagers use that. I don't like it because it's cosmetically not that appealing, but you can use, there's another one called Differin, which is nice. Renova, Tazorac is another one, but it's all tretinoin, and then there's different percentages of it. Yes? So actually, I would put, it depends which moisturizer and sunscreen you're using, but I would put moisturizer on first and then sunscreen, especially if you're using sunblock, because sunblock is going to reflect the rays, and that moisturizer, again, is really creating a barrier. There are some, I have to tell you, there are some sunblocks or sunscreens that have enough moisturization in it that you can get away with just using that. Neutrogena, so Helioplex is pretty decent. Again, it's a little bit trial and error. If you have really dry skin, I wouldn't recommend it. But if your skin is oily enough, then it may be enough for you. Yes? Usually, Neocutis makes one called Neocutis Blanche. That's an over-the-counter. So the question is over-the-counter hydroquinones. Actually, a dermatologist, and I have no conflict of interest, but Katie Rodan and Proactive, so they have one now. And it's from what I've heard and seen from my patients, they like it. So it works pretty well. So that would be another one. Yes, in back. Right, so the question is whether the antioxidants are topical or oral. So they're both right now, but the topicals, so nutraceuticals have the vice, so they're the oral ones, like Borba, which I showed, makes all these claims. But the topical ones have more science behind it than the oral ones at this point, because again, the oral, you may take it and it may do other things for you, but how it gets to the skin and makes your skin better is not entirely clear, where at least topically, some of it can get through the stratum corneum and target the collagen and actually help with that and scavenge free radicals. So I was talking more about the topical ones. Yes, in the back. I think it's a little bit trial and error. It depends if you have oily skin or dry skin. I tend to like Eucerin. So I mean, it also depends how much money you want to spend. So Eucerin is around $5, and I generally recommend that for most people because it's a middle ground. It's not that great. Aquaphor is good, but a lot of people just don't like it. But Eucerin is creamy and it protects your skin, so I usually recommend that. I really like, for higher end, I really like SkinCeuticals. We've been carrying it, and again, I allow my nurses to put it on. So over the last 10 or 11 years, they're the ones who test it out more than I, and so they really like it, and I trust their judgment because again, some of it is a little trial and error. Yes, purple. Yes. So it can get pricey. So SkinCeuticals can be anywhere from $30 to $60. The bottom, I mean, the weakest one would be 30. And so you can go up, if you have really fair skin, we type skin 1 through 6. 1 being those who have no pigment, essentially those who are albino. And then 6 is very dark, those who will not burn at all. And so it really depends on your skin type. But generally speaking, for type 3 skin, usually around 30. But if you are really fair, if you have red hair, blue eyes, blonde hair, then 45 or 60 may be better. But I think the take-home point is reapplying. So if you're outdoors sweating, you need to reapply, or even then, it's not going to last. So you need to reapply a couple times a day. That's the bottom line. Way in the back, yes. So the question is, does fragrance affect the effectiveness of lotions or moisturizers? The question is yes and no. From a biologically active standpoint, it's not going to affect the effectiveness. The problem with fragrances is that they can cause allergies and redness and irritation of your skin. So you have to be careful with that because if it does that, then the moisturizer is ineffective, and then you're going to be using topical steroids. So really, yes and no. Yeah. So scalp itch, it can be a number of things. 1, it can be dry skin, and it may be just that. 2, it can be what's called seborrheic dermatitis, which is irritation of the skin. It's yeast, and it just irritates the skin. You can get it up along your hairline, here too, behind your ears. It could also be mild psoriasis, or what we call sebopsoriasis. You want to first use a moisturizer. If that doesn't work, you want to go to hydrocortisone, over-the-counter 1%. If that doesn't work, then you want to go to your dermatologist and get a stronger steroid. But I think if you moisturize, and again, if you're washing your skin a lot, it's going to dry out your skin. And as you age, your skin is naturally more prone to dermatitis and more irritation, more itchiness. So the question is glycerin and hyaluronic acid the same, and are they similar in how they work? No. Hyaluronic acid is part of your body. Actually, so fillers that we use for cosmetic purposes, Restylane, is a hyaluronic acid. So the thinking is if you lose that because of sun damage and you replace it with hyaluronic acid, that it'll help your skin and help with wrinkles. Whereas glycerin is a humectant, or it will help. It's part of a moisturization, and it acts on the top of your skin. So they act differently, and they can be used in a complementary fashion. White moles. So those are called technically intradermal nevi. They're benign, fortunately. They're not going to generally turn into melanoma. You have to treat them surgically because they're deeper. They go into your middle layer of your skin called your dermis, and topical, they're going to stay there. And dark moles, actually, cosmeceuticals generally will not help with dark moles either. Any others? Or more? You're over? Okay, sorry. I'm happy to answer questions afterwards. But thank you very much for coming.
For more, please visit us at stanford.edu.